Hello, everyone. How are you? Thank you for joining us. My name is Samson Z, and we'll see you again. But right now, ladies and gentlemen, before we begin, I'd like to introduce a very, very special video. Oh, it's good to see everyone. Hey, wave your hands, everyone. How are you doing? If you can hear me, that's nice. Good to see everybody. Tatia, how? Welcome down. Okay, guys, we're going to play a very short video. So please watch the screen as we entertain you with this very, very interesting and educational video entitled Can You See Us, Invisible Nation? Now, Invisible Nation is a Novartis multi-year program co-created with Global Heart Hub and powered by patient organizations across the world. Now, designed to ignite conversation, inspire action, and activate systemic change about unmanaged atherosclerotic cardiovascular disease, or ASCVD, a major driver of heart attacks, strokes, and death around the world. So for more details, you can refer to our chat bot for the link. But right now, let's watch this amazing video. Enjoy.
Can you see us? We are your family, friends, and neighbors.
Living with ASCVD, atherosclerotic cardiovascular disease.
ASCVD is the underlying cause of 85% of heart attack and stroke-related deaths.
This is a disease that threatens all nations and races.
It's real, it's widespread, and despite the alarming numbers, ASCVD isn't widely known.
And too often, it's overlooked.
Every one of us is a statistic, accounted for, but largely unseen.
Most of us are unaware of our risk, or indeed the consequences of ASCVD.
We are
an invisible nation.
It's time to change the course of ASCVD.
To make the unseen seen.
To work together to reduce heart attack, strokes,
and lives lost.
To help the world see that reducing the impact of ASCVD
lifts every nation. Help us to be seen. Share this video and visit invisiblenation.com.
There you go. We hope you enjoyed the video, ladies and gentlemen. Once again, Invisible Nation, something that we cannot see, but it's there. So it's time to educate ourselves. Now, here's a bit more information. Once again, welcome down, everybody. My name is Samson Z, your host for today. Now, did you know that MMM is an international campaign initiated by the International Society of Hypertension to raise awareness about high blood pressure? Now, SHF is supporting this campaign and would like to invite you to be part of the initiative. Now, as part of the campaign, the International Society of Hypertension is conducting a global survey to highlight the importance of BP checks and, of course, better understanding of the impact of high BP on different communities and to improve healthcare for BP worldwide. And at the end of the session, we will share how you can be part of the program. And ladies and gentlemen, did you know that cardiovascular disease, or CVD, is the leading cause of death in Singapore and globally? Now, in 2020, it accounted for 31.7% of death in Singapore and kills 19 people every day. Now, it is hence important to understand its risk factors, such as high blood pressure, and learn how to manage your CVD risk. Now, cardiologist Dr. Lau will answer any questions you have about heart health risk. And if you have any questions for Dr. Lau, please leave your comments in the Q&A box later. So right now, it's my pleasure to invite Dr. Lau Lip Ping, ladies and gentlemen, our wonderful speaker. He's been on our program many times. He's also the Chairman Emeritus, Singapore Heart Foundation. So I present the time right now to Dr. Lau. Enjoy the presentation.
Okay, this is the actual message from the International Society of Hypertension, and this message states that every year, 17th of May, so from now onwards, you want to try and remember 17th of May is dedicated to World Hypertension Day. However, as a result of the rapidly growing burden of disease associated with the global increase in hypertension, the International Society of Hypertension, ISH, and the World Hypertension League, WHL, has designated the entire month of May as May National Measurement Month, MMM. And during this month, that means the two organizations, aim to screen millions of people worldwide who are over the age of 18 years and have ideally not had their blood pressure measured within the previous year. The data collected in MMM will be used firstly to highlight to the public the importance of high blood pressure, and secondly, to motivate governments to improve local screening facilities and policies, and thereby reduce the global burden of hypertension, which causes many cardiovascular diseases that include stroke, heart attack, kidney failure, and dementia. We encourage you to get involved. This message was actually originally sent to the Singapore Hypertension Society. Singapore Hypertension Society works in collaboration with the Singapore Heart Foundation. And Singapore Heart Foundation last month, May, did in actual fact ask members of the public to submit their blood pressure readings. And I believe those readings are at the moment being analyzed by the Singapore Heart Foundation to see whether we can construct some kind of graph regarding the blood pressures of people who have submitted their readings. So I hope if you haven't submitted your blood pressure reading this year, maybe next year, when the May measurement month comes around, you will submit your readings. Okay, this is a slide which tells us why hypertension is very important. As you can see, hypertension is a cause of stroke, both due to blockage of arteries and bleeding into the brain. It causes heart failure. It causes problems in the blood vessels of the eyes, because of which you can go blind. It can cause blockage of blood vessels in the limbs, particularly the lower limbs, and some patients end up getting gangrene. And it is a major cause of kidney failure. And we'll return to each of these things later on. So what I'm going to do today is to see whether we can look at some of the risk factors associated with cardiovascular disease. And I'm going to cover these 4 areas: the relationship between cardiovascular disease and atherosclerosis, what are cardiovascular risk factors, how do you assess cardiovascular risk, how do you manage those cardiovascular risks that you find that you may have. But first of all, I want to give you a little bit of background regarding the circulatory, or what we call the cardiovascular system. And this is a picture of the heart. And the heart has, as you can see, 2 sides here. On each side, you have a chamber called an atrium. On the left atrium, on the right atrium, and then another chamber called the ventricle on the left and on the right. And as you can see, there is an arrow here from each of these 2 atria showing the direction of blood flow from the atria to the ventricles. And from the ventricles, blood is pumped out from the left ventricle and from the right ventricle. And in the next slide, I'll show you more details. Okay, this is a little bit more complicated, but I hope you will stay with me as I go through these details. So on the left side, you have the left heart, the left ventricle, containing blood that is full of oxygen. And this blood is ejected from the left ventricle, and it goes into what we call the systemic circulation. Systemic circulation goes to the upper part of the body, to the brain and upper part of the body. Another amount of blood goes to the lower part of the body, to the trunk and limbs. And note that this blood that goes to the what we call the arterial system contains oxygenated blood. So it's like a car that has filled up its tank with petrol. And then as the blood flows through the tissues, some of the oxygen is used up, and the blood then comes back to the right side of the heart. After some of the oxygen has been used, is then pumped by this chamber on the right side called the right ventricle, and is pumped to the lungs, to the right lung on the right, left lung on the left. And in the lungs, the blood picks up more oxygen. So it's like, again, a car going to the petrol station, filling up with oxygen or petrol. Then the blood comes back to the upper chamber on the left side of the heart after it has been filled with oxygen. So that is the way the body organizes itself, so that we constantly receive oxygen through the arterial blood and sending the venous blood back to the heart to be pumped to the lungs to refill with oxygen. Now, this is a picture of the heart and shows two very important blood vessels. And these two important blood vessels are called coronary arteries. And on the left side of the heart, the left ventricle, we have the left coronary artery, and then another artery on the right side called the right coronary artery. These two arteries are very, very important because these are the arteries that supply blood and oxygen to the heart muscle so that the heart muscle can function normally. Without adequate oxygen, without adequate blood, then you find that the myocardium, or heart muscle of the heart, will not function properly, and you may get a condition called heart failure. So now I want to try and answer this question: what is cardiovascular disease and atherosclerosis? Cardiovascular disease most frequently is due to a condition we call atherosclerosis. And the question is, what is atherosclerosis? So first of all, I want to show this picture of an artery. This is a normal artery. If you cut it open, you will find that it has three layers. There is a layer next to the blood within the blood vessel. This layer is called the intima, and it contains a layer of cells called endothelium. And then there's a middle layer called the media, which is largely made up of muscle. And then there's another layer called adventitia, made up mainly of what we call fibrous tissue. Now, this picture shows on the right here the development of a process we call atherosclerosis. And a localized area of atherosclerosis we sometimes refer to as an atheroma. And the material that is inside the atheroma is made up of cells we call macrophage cells, as well as fatty substances called lipids, calcium, and fibrous tissue. And we're going to look at why atherosclerosis develops. Okay, before we do that, this is to show that the atherosclerosis shown on the left here has a thick cap called a fibrous cap, which is thicker and less cellular than normal intima. And this is the pattern of the fibrous cap that we find in what we call atherosclerotic plaques. Now, sometimes this fibrous cap thickens, and the various processes, not thickens, sometimes the fibrous cap thickens. And the reason for this thinning is due to quite a number of sometimes different reasons. For example, inflammation may occur within the atheroma, or there is accumulation of a lot of cholesterol, fatty substances, and then sometimes this cap becomes thin out, it ruptures. And when it ruptures, it encourages the development of a blood clot. And if the blood clot is big enough, it will block the blood flow. And that is the basis of attacks in the heart, in the brain, and elsewhere, causing heart attacks and stroke. And this shows you that atherosclerosis can occur in any of the main blood vessels of the body, be it in the brain, where you can get stroke, in the case of the heart, where you can get a heart attack, or if a heart attack hasn't occurred yet, the patient may suffer chest pain called angina. It may affect the kidneys, causing kidney failure, and it may affect the blood vessels of the legs, causing what we call ischemia. and sometimes pain in the limbs called claudication. This slide is to show you that this process can start very early in life, depending upon the presence of risk factors for atherosclerosis, because some people may be born with certain genetic factors that increase the risk of atherosclerosis, and then it progresses year by year and decade by decade. And subsequently, when the atherosclerosis becomes severe enough, we find that it narrows the opening of the arteries, then the blood clot may form on top of it. And as I mentioned earlier, depending upon whether it is the heart or the brain or the legs, you may have various consequences. And of course, if it's severe enough, that it may cause death, whether due to a stroke or due to a heart attack or due to heart failure. Now, this slide shows you the causes of death in Singapore from 2018 to 2020. And if you look at 2020, ischemic heart disease, coronary heart disease, caused 20% of all deaths. Strokes due to atherosclerosis in the blood vessels of the brain, 6%. And then hypertensive disease, when it causes death, some of it is due to atherosclerosis, another 3%. And then other diseases due to atherosclerosis, about 2%. So the total number of deaths due to cardiovascular disease is about 31.7%. That is almost 1/3 of all deaths in Singapore is due to cardiovascular disease. So it's very important to understand what you can do to try and reduce the risk of death due to cardiovascular disease. So what I'm going to do now is to talk about cardiovascular atherosclerotic risk factors. What are these factors that increase the risk of atherosclerosis? And on this slide, it shows that cardiovascular risk factors, we can divide them up into three: those which are not modifiable, those which are modifiable but related to lifestyle, and then there are those that we call medically treatable risk factors. And this slide shows you that of the factors which are not modifiable, some of it is due to the fact that some people very early in life may already have developed atherosclerotic disease because of genetic factors, or because they may have certain things like high blood pressure and high cholesterol at a very early age. And then there are non-modifiable factors which are related to age and gender, which we are going to amplify in a while. Then there are modifiable lifestyle-related factors. These are factors where by changing lifestyle, we may reduce the impact of these risk factors. Then finally, we're going to talk about medically treatable risk factors. Those factors where medical treatment is available for reducing the impact of these risk factors. So let's start with personal history of coronary heart disease and family history of coronary heart disease. We know that the younger the age of onset of cardiovascular disease of affected family members, the greater the risk, as I mentioned. Some people may possess certain genetic factors which may already have been present since young. If there is a family history of cardiovascular disease, particularly if a parent or a sibling has a history of cardiovascular disease at a fairly young age, say when you're in your 30s, in your 40s, we know that that is likely to be a strong genetic factor. And that's something that somebody who has that kind of history should take note of, and then go and check out to see what the particular factor might be that increases the risk of people in that family. And then there's the question of age and gender. And this is to show you a slide from a registry we call the Singapore Myocardial Infarction Registry. Now, do you know that all heart attacks in Singapore are notifiable, like infectious disease? If you don't, then I think in future you should take note of it, because if you do not report a case of somebody who dies of a heart attack, if you don't notify it, it's actually a punishable offense. The data of all heart attacks is then kept in a registry called the Singapore Myocardial Infarction Registry. And I might just say that the money to set up myocardial infarction registry, I think some 20 years ago, was actually raised by the Singapore Heart Foundation. And that money was given to the Ministry of Health, and we started the first registry, and subsequently the Ministry of Health took over the running of this myocardial infarction registry. And this registry at the moment is being managed by a committee based in the National National Cardiac Center. Anyway, this registry shows you that in the year 2016, the analysis of people who had coronary heart disease, you can see the relationship to age. At the age of 80, the risk is very, very high. In those who are like 15 to 29 years, the risk is very slow. So age is a factor that we should take note of. The older you are, the more prone you are to coronary heart disease, the more you should actually check out what is the status of your heart. And then there's a question of gender, and we know that unfortunately, or maybe fortunately from the point of view of the women, the risk is higher in men than in women. You can see here the blue lines, the solid line, the dotted lines show that in men over the years, the risk of a heart attack is always consistently higher than the red lines, which indicate the number of women who suffered heart attacks and are registered. These cases have been registered in the Singapore Myocardial Infarction Registry. Okay, so we now go on to modifiable lifestyle risk factors. And the first one I'd like to start off with is smoking. And this is data from the Singapore National Health Survey reported in 2020. And you can see that a lot more men smoke than women in Singapore, that the peak incidence of smoking in Singapore amongst the men is in the age group 50 to 59. After that, it looks as if men, as they get older, tend to smoke less. The overall smoking rates for men is 17. We are not so high as in some countries where smoking rates may be 30, 40, 50, but we are actually still significantly higher than in some countries. For example, I think in Finland, they've got the rates down to just single numbers. And also, I believe also in New Zealand, they're aiming at getting their figures down to less than 10. So we have some way to go to try and improve our figures. Maybe the men can learn something from the women about not taking up smoking. Okay, this is to show again data from the same registry and looking at some of the major risk factors related to people who had heart attacks, and you can see that smoking was a risk factor in roughly about 50% of all of these people who were reported to the Myocardial Infarction Registry. So smoking is definitely a very strong risk factor, and we urge all smokers to try and stop smoking. Okay, this is just to remind you that there are many health hazards of smoking. This is just a short list. There is actual fact a much longer list of all the things that can happen. We know about the risk of cancer. That's the most important danger of smoking. But cardiovascular disease also is affected very much by smoking, both in both the coronary arteries and the arteries in the brain. You can see that smokers have a much higher rate of getting a heart attack and stroke than the people who don't smoke. This is data taken from a very large international study over 52 countries. And Singapore was one of those which contributed data to this very large study. And you can see that in this study, when they related the risk of getting a heart attack or MI and the relationship to smoking, you can see that it's a straight line upwards. The more you smoke, the greater your risk of getting a heart attack. Okay, the next lifestyle risk factor is obesity. And this is to show you data that is actually taken from WHO as long ago as 1997. And it shows that obesity greatly increases the risk of diabetes, high cholesterol, insulin resistance, which is a stage in the development of diabetes, coronary heart disease, and hypertension as well. So obesity is definitely also a major risk factor. Now, how do we measure obesity? One way, common way we have is to take the weight in kilograms divided by the heart in meters squared, and that's called the body mass index. And in Singapore, anybody whose body mass index is more than 23 is considered overweight, and if you're more than 28, you're obese. Another way is to measure waist circumference. Weight for height tables, waist to hip ratio are not so convenient ways of looking at whether you're overweight or not. Okay, and this is one of the proposed classifications of obesity for Asians, just to show you that if your body mass index is under 18.5, you're considered to be underweight. If you're 18.5 to 22.9, you're considered to be normal. If you're overweight, 23 to 24.9, you're considered to be moderately obese. Obese one is 25 to less than 30, and more than 30 considered to be severely obese. Okay, and this is a study where they related BMI to the risk of dying in men from coronary heart disease. And you can see that from a BMI of about 22, the risk of dying from heart attack increases very steeply as your weight increases. Interesting enough, those who are underweight also have a slightly higher risk, but that's probably related to other reasons than just due to coronary artery disease. And the same kind of thing can be seen in women, as you can see, from a BMI of about 23, then your risk of dying from cardiovascular disease increases very steeply. So overweight is something that we should pay a lot of attention to. Then the next thing I want to look at would be dietary factors. And there's one thing I want to clarify, because there is a lot of myth regarding dietary cholesterol. People talk about good cholesterol and bad cholesterol. In actual fact, there is no such thing as good or bad cholesterol. Cholesterol is cholesterol in the diet. And the recommended allowance for dietary cholesterol is not more than 300 milligrams a day, which in actual fact is the amount that average diets contain. Very few people actually take in more than 300 milligrams of cholesterol. And we know that people who are vegetarians, pure vegetarians, the dietary cholesterol is still something like about 200 to 250. So trying to reduce your dietary cholesterol, actual fact, is really not very effective in lowering your blood cholesterol. Now, the Health Promotion Board says that you should take no more than 4 egg yolks a week and limit consumption of organ meat and shellfish to no more than twice a week. Each egg yolk actually contains about 250 milligrams of cholesterol. But as I said, the amount of cholesterol in your diet is not really a very big issue. It is the amount of fat, in actual fact, that's a lot more important. And there are 4 different types of fat found in food that we eat. there is what we call saturated fat and trans fat. And those, in actual fact, do increase the risk of atherosclerosis. But another type of fat called monounsaturated fat, polyunsaturated fat, which are found in vegetable oils, olive oil, and so on, they do not increase the risk of atherosclerosis. Whereas saturated fat found in the dairy products and in fatty cuts of meat, these are the ones in actual fact that can increase the risk of atherosclerosis because they contribute to the formation of blood cholesterol. Okay, so saturated fats are found in animal fat, for example, fatty meat, the skin of poultry, lard, full cream milk, butter, ghee, coconut milk, coconut cream, and then deep fried food prepared with palm-based vegetable oil. And a diet high in saturated fat does raise the level of LDL cholesterol, which in turn increases the risk of cardiovascular disease. This is to show you, and this is a lot of detail. If you want to look at these in detail, you can go to Singapore Heart Foundation to the website, because it tells you what is good fat. Good fat is monounsaturated fat, and the sources are various types of vegetable oil, whereas saturated fat is found mainly in animal fats, in some dairy products, palm oil, coconut oil, and so on. Okay, a word about trans fat. Now, trans fat is formed when vegetable oils undergo hydrogenation, which is actually fact a commercial process to harden oil for production of fats like shortening and hard margarine. And trans fat does increase LDL cholesterol and lower HDL cholesterol in the body. As a result, trans fat does increase the risk of developing cardiovascular disease. And the main sources of trans fat in our diet are pastries and cakes, deep fried fruit, coconuts, cookies and biscuits, and products containing vegetable shortening, hydrogenated or partially hydrogenated oils as stated on the ingredient list of food labels. And foods high in trans fat often contain high amounts of saturated fat. In actual fact, in Singapore now, the law does not allow more than a very minimal amount of trans fat in all dietary products which are sold in the supermarket. Okay, a word about sugar. It is thought that consumption of sugar should be no more than 10% of our daily energy intake. So for more adults, that is about 10 teaspoonfuls of sugar, based on an average calorie intake of about 2,000. And if you are determined enough, a further reduction to about 5 teaspoonfuls can bring about additional health benefits such as a decrease in weight and decrease in the level of blood sugar. And excessive consumption of food and drinks high in added sugar may lead to weight gain if the excess calories are not burned by exercise. Okay, now a word about salt. Dietary salt contains sodium chloride, and 1 gram of salt contains about 400 milligrams of sodium, 600 milligrams of chloride. And we know that sodium increases blood pressure by mechanisms which are, in fact, which we don't actually fully understand. So why do we consume less sodium? Because eating too much sodium does increase your blood pressure, which, as you know, is a risk factor for stroke and kidney disease, as we have already alluded to. And if you want to look at products carrying the healthier choice label, which tells you which product contains how much sodium, you can look for this healthier choice symbol. Incidentally, healthier choice symbol was in actual fact first designed by the Singapore Heart Foundation, and it was sold to the Health Promotion Board for a princely sum of $10. So when you look at this symbol, think of Singapore Heart Foundation as being the organization which actually started this symbol. Okay, and then there is a question of lack of exercise. And I want to show you this Singapore Physical Activity Guidelines which were just released on Monday. I don't want to go into details because there's a lot of details in the guidelines which you can look at. But it's interesting that the guidelines mention that regular adequate exercise does reduce coronary heart disease, does reduce stroke, does reduce hypertension, which is what we are also talking about. So go out and shake a leg and move yourself and lower your risk of all these things that we've been talking about. And the guidelines do say that any level of physical activity is better than none. Where possible, adults should break up prolonged sedentary periods with light physical activity for health benefits. And it now says you should accumulate a total equivalent of about 150 to 300 minutes of moderate intensity activity. Previously, the guidelines say exercise up to 150 minutes of activity would do, but now it says 150 to 300 minutes. So it looks as if we will all have to go out and exercise a little bit more. Okay, and then lastly, we talk about medically treatable factors, and I'm not going to go into any detail because in actual fact, this is going to be the topic of the part 2. But just to mention that there are certain fatty substances in the blood called low density cholesterol, high density cholesterol, and triglycerides. Low density cholesterol is in actual fact bad cholesterol, and it is the cholesterol that is strongly associated with development of atherosclerosis. And we know that every 10% increase in LDL cholesterol does increase the risk of coronary heart disease by 20%. Clinical practice guidelines recommend that your blood LDL cholesterol of 100 milligrams per deciliter is what you should be aiming at in people who are of average risk. But if you have other risk factors, if you have diabetes, for example, and you smoke, for example, then many of the guidelines nowadays are very aggressive and they say you should lower it down to even as low as 55 milligrams per deciliter. Now, I want to say that there is no truth that low LDL cholesterol is harmful because in actual fact, if you look at babies at birth, their LDL cholesterol are in actual fact below 30 milligrams per deciliter. And no harm comes to them for many years while their LDL level remains so low. On the internet, you'll find a lot of, unfortunately, not truthful information to say if the LDL cholesterol is low, you'll suffer from dementia, you'll get cancer, and so on. No truth in that, and I repeat again, do not believe people who tell you LDL cholesterol too low harms you. LDL low reduces your cardiovascular risk, which is the most important thing. Okay, I'm going to show you this slide from a study in the US. Very large number of individuals, more than 300,000, and you'll find that at every age, as the cholesterol increases, the risk of disease due to cardiovascular disease in actual fact increases. So increase in cholesterol increases your risk, and no truth that lowering your cholesterol increases your risk. Is the opposite. And this is another study that shows you that as your LDL cholesterol increases, the risk of coronary heart disease increases quite steeply. Okay, a word about good cholesterol. We know HDL cholesterol has a protective effect for risk of atherosclerosis and coronary heart disease. And the lower the level of your good cholesterol, the higher the risk for atherosclerosis and coronary heart disease. And we know that if your HDL cholesterol is less than 40, the risk is significantly higher. HDL cholesterol tends to be low when your triglycerides are high. And we know HDL cholesterol is lower if you are a heavy smoker, if you're obese, and you're physically active. Unfortunately, in recent years, people who have been treating people with low HDL cholesterol medications have not been able to show you that medication to increase HDL cholesterol is effective. And so many of these clinical trials now have been stopped because it's been shown to be futile. Okay, a word about triglycerides and saturated fats. We know that saturated fats is associated with an increase of coronary heart disease, is linked with, but this link is actually complex. A normal triglyceride level is less than 150 milligrams. Very high triglycerides, we are more worried about people getting pancreatitis rather than coronary heart disease. And pancreatitis is an inflammation of the pancreas that can result in actually diabetes. Okay, so the last two medically treated risk factors, last three are inflammation, diabetes, and an increase in blood pressure. But I'm going to leave this to the next episode, and I hope you will join me 25th of June 2022. We will elaborate on those risk factors, and finally we will wrap up the question of how to reduce your cardiovascular disease and atherosclerosis. So next episode, inflammation, diabetes, down with high blood pressure. And for those who are fathers and grandfathers, happy Father's Day and Grandfather's Day tomorrow. Thank you.
Well, thank you so much, Dr. Lau, for the very detailed presentation. I hope you guys enjoyed it very much. Well, it's time for a Q&A session, but a quick recap of what, already a summary of what Dr. Lau has mentioned earlier on. So let's take a look, folks. What are the details, the facts that you need to know very quickly? First of all, we have the non-modifiable factors and also modifiable factors as well. So the non-modifiable are your gender, your age, and also your DNA as well, your family history. The modifiable factors are like smoking and obesity, where you can reduce them, type of food that you eat, and also the exercises. And some are medically treated as well. So these are something like diabetes, blood pressure, inflammation, and cholesterol. So these are the three factors that's very important to us, and we should take note of it as well. And Dr. Lau also mentioned several types of fats as well. So what is polyunsaturated fats, monounsaturated fats, or just fats, bad fats. Yeah, so you need to avoid all these types of food as well. Reduce salt and sugar, and finally, don't forget to exercise as well. So let's go to our first few questions we have for Dr. Lau. And we have just about enough time to answer maybe 4 or 5 or 6 questions. So let's begin with the first one. Now we have someone who asked this very, very simple question. Simple, but I'm not sure if it's I would say technical. What is an acceptable high pressure reading for an elderly person age 75? What is the suitable reading, Dr. Lau?
Okay, I want to say that you will find the answer next week if you come back and listen to the talk. But in short, if we take most people except elderly people above the age of 80 in the clinic, we like your blood pressure to be 140/90 or less. But when you go home and you are not stressed by the doctor, your blood pressure should be lower, and we recommend a blood pressure of 130/80 or less. This blood pressure should be taken, best time to take it is in the morning. And when you take your blood pressure in the morning, make sure your bladder is not full, because if you have a full bladder, your blood pressure sometimes is artificially high. So go and empty your bladder and just relax in the morning. Take maybe 2 readings, 3 readings. Discard usually the first one, because the first one tends to be a bit higher. Take the second or third one, and at home we recommend for most people blood pressure 130/80 or less. There are other factors which determine what would be the desirable blood pressure, but I think we wait for Akan Datang next week.
Very good. Another question here from Sanya. When I'm sleeping on my right side, I feel like I have difficulty breathing with my heart, and my heart is pounding. But when I sleep on my left side, it's perfectly okay. Is there a blockage in my cardio system?
Usually it is not a problem of your cardiovascular system. It is sometimes related more to, in actual fact, your lungs. And if you find that sleeping on one side affects your breathing, you might want to check with your doctor as to whether you have a problem in your lungs. We know that some people have chronic lung disease due, for example, to heavy smoking, and one lung may be more affected than the other, and then sleeping on the side where that lung is more affected may make that person breathe a little bit, would make that person feel a bit more breathless sleeping on the side. But in some people, it's just due to your body build and not to any other important risk factor, any other factor.
Thank you. Next question coming from Evelyn. Now, may I know, taking cholesterol and aspirin medication, will it affect your heart in the long run?
If in actual fact it's been recommended by your doctor, in actual fact, the effect on your heart is beneficial. Now, aspirin is a medication which we call an antiplatelet agent. There are small little cells circulating in our blood called platelets. And earlier on, you remember I talked about atherosclerosis and atherosclerotic plaques. Now, when you get an atherosclerotic plaque, one of the cells which gets attracted to this plaque is the platelet. And if platelets accumulate, they can form a blood clot. And aspirin is in actual fact prescribed to make the platelets less sticky, so they are less likely to form a blood clot. However, aspirin can have side effects, one of which is it can cause irritation of the lining of your stomach and may therefore increase your risk of bleeding from the stomach, so that when the doctor prescribes aspirin, you may want to tell the doctor whether you've got a problem with your stomach, you have a history of ulcers, gastritis, you want to make sure that it does not cause you to get irritation of stomach and bleeding. Now, cholesterol medicines taken long term, generally speaking, have got no significant adverse effects. The group of cholesterol medicine that has the longest history are the statins. And statins have been prescribed, I think, since about 1970. So we have a long history of information about the benefits and adverse effects of statins. And long-term effects, generally speaking, are minor and not significant. A small percentage of people can get side effects like inflammation in the muscle, but these generally occur very early, and in most patients, after taking the statin for a little while or changing the statin, this side effect generally will disappear. There have been in the past rumors about statins causing cancer. So clinical trials have been conducted on statins to specifically look at the development of cancer. These trials have shown that there is no truth that statins cause cancer. Okay. Does that reassure the questioner? Okay. Anyone else?
All right, we have last two questions. Now, does taking calcium tablet or medication with high calcium ingredients affect the heart disease? Does it increase my risk factor for heart disease?
Okay. Yes, I think I think it's a very valid question to ask, because we know that the plaques in your arteries, if you develop atherosclerosis, subsequently calcium can get deposited. But that calcium is not really related to the calcium in your diet. It is related to calcium circulating in your blood. And calcium goes into the plug only because there is atherosclerosis there. If you do not have an atherosclerotic plug, the calcium by itself does not get deposited in your arteries. So taking calcium as a supplement, sometimes prescribed by doctors for those who have problems with their bones like osteoporosis, that's quite safe to continue to take.
All right, let's go for the final question. Final question is, what if somebody has a minor heart attack and stroke symptoms, and then before it, when will it relapse? When will I get the next relapse? How long does it take, and will I get a worse one?
Okay, that's something probably again best discuss with your doctor, because the doctor can then check on the degree of your disease, whether your plugs are causing significant narrowing of the arteries, either in the heart or in the brain or arteries of the legs. And he can check on your risk factors and say your risk factors are very high. For example, your blood sugar is very high, your cholesterol is very high. Therefore, your plugs are more likely to increase in size, become unstable. So it depends, therefore, upon the level of your risk factors. It depends upon the size of your plugs and whether your plugs are stable or not stable. Let's check with your doctor.
So, well, that's the reason why most of us, we recommend that you go for regular medical checkups so you can speak to the doctors and ask your questions there as well. Now, we have so many questions that we can't answer them all because we'll still have more to go. So now, before we end our program, we have some announcements to make, but would Dr. Lau, would you like to share some final remarks, some other tips that you'd like to share to all our viewers?
Okay, the first thing is find out what atherosclerosis is, and I hope that you know what are the major risk factors for atherosclerosis. If you find yourself having those risk factors, including things like your blood pressure, or if you're a smoker, for goodness sake, stop smoking. If your cholesterol level is high, talk to your doctor about how you can reduce your cholesterol level. If your diabetes is not well managed, talk to your doctor. Ask him how you can better manage your risk factor. And if you have not been exercising according to the latest physical activity guidelines, then do please read those guidelines and see whether you can comply with those guidelines. So look at your risk profile, the level of your risk factors, and I'm sure then you'll become less liable to get a heart attack and get a stroke.
Well said there. Thank you, Dr. Lau. Now, thank you so much, Dr. Lau, our sponsor, Novartis, ladies and gentlemen, as well as all of you, our viewers, for joining us today. Now, we hope you have learned more about managing your heart health risk and are encouraged to make better lifestyle choices. Now, before we end the session, we also like to share that the MMM Global Research with you, as mentioned at the start of this session, the International Society of Hypertension is conducting a global survey on high blood pressure. And we are giving away 15 prizes to all our participants here. So please take part. Now, to enter, all we have to do is to measure your BP readings 3 times using a BP monitor and take photos of your 3 readings. Now, the BP measurement should be taken on the same day, each reading 2 to 3 minutes apart. Why? Because we want to get a more consistent reading from you. Now, you can fill up the questionnaire and upload your photos on this page. Now, upon submission, you will also enter the draw and stand a chance to win a wrist BP monitor worth $219, XR Spark plus wearable worth $70, or you can also walk away with supermarket vouchers worth $30. Now, we have 5 sets each to be won, and of course, our wonderful admins will actually put down the information for you, the website link and so forth. You can just click there to take part. And don't forget to join us, ladies and gentlemen. And once the webinar ends, please join us to fill up the survey form by clicking on Continue tab to participate in a short survey. Now, remember, we have more coming up for you, as Dr. Lau mentioned, and we appreciate if you could take some time to share your thoughts on today's talk by completing this survey form. And before that, a gentle reminder to join us for part 2. Okay, please sign up because I'm sure it's very, very interesting. Now, part 2 series on hypertension talk, high blood pressure, next Saturday, 25th of June, next Saturday at 2:30 p.m. You can learn more about high blood pressure and how to reduce your risk of hypertension. Okay, so please join us for more. We hope you come back and bring more friends. The more you educate your friends, you might be saving somebody's life. Yeah. So with that, ladies and gentlemen, thank you so much. Please join us with a survey. All right, very easy questions to answer. If they ask you, just say you're a Southeast Asian, fill up your gender. Pretty easy to actually fill up the form. Okay, so with that, ladies and gentlemen, have a great afternoon. And once again, to Dr. Lau, thank you so much for joining us. It's been our pleasure, to our sponsor Novartis, and to you, ladies and gentlemen, for making time to be here and joining us. We hope to see you again next week, and please join us for more at the Singapore Heart Foundation webpage and our Facebook page as well for more videos and interesting facts. Thank you so much, Dr. Lau. Thank you, everyone. See you soon.
No, right, good.